Well, we've been following the public health data and the COVID data, and we continue to talk to our medical advisory board and to track some of the data that comes out of the CDC as well. We've generally been making announcements on issues around COVID that involve sort of the state of play generally every 2 or 3 weeks, and I expect we'll have some stuff to say before the end of April. But at this point in time, I'm with the mayor. People need to continue to follow the rules and the guidance. As I said, people need to continue to get tested, okay? I mean, a lot of folks have sort of substituted in their own mind the idea that I'm going to wait till I get vaccinated and I'm not going to continue to test. Testing across the country has dropped dramatically over the course of the past 3 or 4 months. I'm pleased to say that in Massachusetts, the numbers sort of vary somewhere between 85 and 95,000 tests a day. But if you're around somebody who's tested positive, or you've been traveling, or whatever the issue might be, there's still a ton of testing infrastructure out there. It's free, it's available, you should take advantage of it. But I think it's really important for people to understand that we are not done with COVID. We will probably not be completely done with COVID for quite a while. We'll probably be talking about booster shots at some point when we get past the point where we all get vaccinated fully for the first time. But I think it's important for us also to move at a pace, which we've tried to do since the first reopening panel by the Lieutenant Governor, to make sure that the reopening process we pursue is one that's consistent with the guidance and the recommendations we're getting from the experts and doesn't create a bounce in the wrong direction with respect to surge and additional cases and hospitalizations. So the answer to that is you're going to have to wait and see. Yeah. I guess the biggest thing with respect to the rollout generally is I happen to think that the mixed model we've used is the right one. In certain parts of Massachusetts, we used regional collaboratives. In certain parts of Massachusetts, we used just the basic healthcare infrastructure that was already there. In other parts of Massachusetts, we had local boards of health focused on very particular populations that they knew best and how best to get to them. Mass vac sites and community health centers. They have all played an important role here. The overlay of the retail pharmacy program from the federal government, which has really been in many respects the primary push from the feds on supply generally over the course of the past several months, I think has been a really good complement to what the rest of us have been up to and the rest of us have done. But I think in many ways the biggest lesson I take away from all of this is the idea that one size fits all in any of this makes no sense, because we have 7 million people living in a whole variety of different ways in terms of population density, geography, access to existing healthcare infrastructure, and all the rest. And I think the thing we have to do when we get into a place in a position like this is recognize and appreciate that what works in Eastern Mass is going to be different than what works in Western Mass, than works in Central Mass, that works on the Cape. Can I let some of the other folks who have their hands up ask? Yeah. I can't hear you. Yep. Generally speaking, if folks want to be in the pre-registration system, come on down. But not everybody does. And our message to people generally has been, if being in the pre-registration system is a place you want to play, we'll help you figure out how to get there. But it hasn't been something that everybody has felt needed to be part of the way they did their business. Hospitals are not in the pre-registration system. Community health centers are not in the pre-registration system. Some of the regional collaboratives are, some of them aren't. Some of the local boards are, some of them aren't. The only folks that are absolutely positively in the pre-registration system are the mass vac sites. And again, that's another one where our point of view is we'll work with people to set up models that work wherever they might be in Massachusetts, but we're not going to presume that what works for some is going to work well for others. The other thing I would just point out about the pre-registration system, it's ended up serving in some respects as kind of like a safety net for a lot of people. There's continually been about 1.5 million people who who are carried in that system sort of almost every day, but it's a different 1.5 million people as folks have signed up. And we've had about 300,000 plus or minus, probably more now, who have unsubscribed because they got an appointment somewhere else. You know, they set up, they hopped on when they were eligible. It was sort of that thing that they could, you know, wait and see when they would get assigned to a location. But then for many people, they got one at a pharmacy. They got one at a regional collaborative. They got one at a community health center. Their clinician or their hospital called and told them that they could come get a shot there. And so I actually think it's basically playing as kind of a, it's the right thing for some, but for many people it ends up being where they go if they don't land one somewhere else. Yeah. Yep. Yeah, that's absolutely right. There are counties and there are states that are no longer even taking down the available allocation that's made available to them by the feds. They basically said, don't send us any more. We haven't been able to put the stuff that you've sent us recently to work. That is not what's going on here in Massachusetts. And I have said to the feds, if you folks have states, if you folks have counties that aren't taking the allocation, remember the whole allocation for all of this is a population-based allocation. You know, states, counties, most of the distribution is done based on your population. And if you have folks who aren't taking down the allocation that's being made available to them, we here in Massachusetts would love to have that because we have people who want to get vaccinated and we have an infrastructure that could probably do 2 times or even 3 times as many doses a day as we do now. And the feds have basically said, yes, we understand and we recognize this is an issue. We haven't figured out what we think is the right answer for it. We're going to continue to press on it. Darlene and the mayor both said they've talked to the delegation about this. I'm going to be talking to folks in the delegation next week about it. I think it's really important if there are parts of the country where there are folks who want to be vaccinated, maybe the feds should think about changing some of their allocation methodologies to acknowledge and to acknowledge that fact and to move it to places where it will get used. Yeah. Can you step forward a little bit? I think with respect to the walk-in piece, part of the reason we've been doing appointment only is the issues around storage, prep, and the potential loss of 2 very sensitive vaccines. Both Pfizer and Moderna require deep freeze, thaw the night before based on the amount of appointments you think you're going to have the next day. It's only good for 6 hours after it thaws. And I think from our point of view, the way to ensure that we really limit the number of doses we actually end up having to throw away, and the number we have thrown away is incredibly small given the number we've actually administered, is to have an appointment-based system. And I think it's worked and worked pretty well for us. We have talked to folks in the hospital community about how a walk-in process would work, but they and we both continue to fill the vast majority of the appointments that we make. With respect to hard-to-reach populations, we were using the J&J vaccine, I think, quite effectively here and in a whole bunch of other places to do mobile-based delivery and to go to where people were. Senior housing, community centers, senior centers. We did a ton of work early on in this with folks like the folks here around homeless shelter. We were the only states in the country that had homeless shelters and mental health group homes and residences, congregate care of almost every kind. And that worked really well. But again, you know, the two-dose piece for that population can be complicated. So what I would say is I'm kind of waiting to see what the answer is on J&J and what people's attitudes about it might be after the pause, because I think it's a big part of how you get to some of those populations and run a successful walk-in operation. Does anybody who didn't ask one want to ask one? Okay, go ahead. Well, one of the good news, you know, one of the good things about the booster, if there is a booster, when there is a booster, is it's one. All right, keep in mind that one of the great challenges of this thing logistically and in terms of capacity generally from the beginning has been it's two. So instead of having the one and done as the primary vehicle through which we deliver this, it's two doses. And you know, all of us spend a lot of time talking about how many first doses we get, how many second doses we get, and how many chairs having first and second doses means we need to use, and how long it takes, 8 weeks typically, to get somebody fully vaccinated. If you get into a booster agreement, I think that changes the game a lot, and it changes it with respect to the role and participation of doctors' offices. You know, people could just get them as they get their annual physicals. I mean, there's a lot of other channels that are hard to make available when you're playing this two-dose game with a deep freeze and you're trying to get as many done as possible. I mean, remember, if we get to where we would like to go, because demand stays high and the supply's there, between December 31st and May 31st, we'll have done about 8 million doses. I mean, that's a very different kind of number in a very short period of time relative to what a booster process would look like. I do want to thank, by the way, Senator Hines for deciding to get his vaccine while he was here with us. He's chit-chatting, so he doesn't hear me saying this. And I also want to say, where did Representative Farley Bouvier go? There she is. First of all, it's great to see you. But secondly, I don't know if any of you have seen her 360-degree economic development in Pittsfield video. Is that thing available somewhere? It's one of the coolest and most creative ways to sort of speak to what's going on in a community that I've seen somebody do. And a lot of that work was very much partnership based. And as we get answers on questions about J&J and on supply, we will certainly talk to you folks, because we know that you can do a lot more than you have doses to do at this point in time. And I thank you again for the excellence of the work that you have all done and for your partnership on so many of these. It's a great story. Thank you.